I just will say, if you take a look at their names and faces, remember them. These are leaders in our field around the world who are doing tremendous work to help bring misophonia to the public in ways that are really helpful, whether that's via Instagram or whether that's via podcasts or whether that's via websites or associations. All of these folks are doing work that is just really, really, I think, important to highlight. One of the things that they do for us is they help us decide which speakers to invite. So the process we have for this Care Day is we and the advisory committee sit down and we look at all of the research that's happened over the last year and essentially nominate what we think would be the most noteworthy of the past year, the most noteworthy of scientific research that we think would be helpful to bring to the public and have a conversation about. And so that's how we got here for the particular speakers that we have. We'd like to acknowledge a number of people, and there's too many people to list by name, but we do want to acknowledge those people who have directly supported Care Day, including those people highlighted here on this slide. Thank you to everyone, from those who've provided some funding and support to those who provide the backstage support, to our volunteers and staff who have helped us be able to put this whole event together, to our moderators who you will meet and you will interact with, of course to our speakers who you will hear, and to all of you as attendees who are here to support this work. Misophonia it's interesting, you know, as a scientist and clinician, as a teacher, as an advocate, and maybe most importantly, as someone who has misophonia in his family every day at home, I am really excited about the increase in research that we see in misophonia in the last few years. This graph here shows you, as of the end of 2023, the number of scientific publications that have been put forth on misophonia. And you can see really clearly that in the last 3 years, we've seen a real significant increase. The research is accelerating, and several years ago, Cris and Dr. Brout and I got together and said, how can we get the science to actually be meaningful and helpful? How can we get the science out there to people in a way that is inspirational, is practical, and makes sense? And you know, if you've ever listened to scientists talk about their science, scientists can be a little bit like teenagers. If you've ever had conversations with teenagers, you know that teenagers, when you talk to them, sometimes they talk and you hear words, but you don't actually know what's being said. And so it's this experience of listening, but not totally understanding how to make sense of what that person is saying. And I think scientists do the same thing. We scientists, sometimes the way we communicate is in a way where it's hard to understand what we actually are talking about. So our purpose for today is really to share research in the past year about misophonia with everyone. So we want to make the science today accessible, useful. We want this to be hopeful and empowering and inspiring to people. Our goal is to have conversations among researchers, sufferers, family members, clinicians, advocates, everyone, anyone and everyone. We want everyone to be able to understand what the researchers are saying in a way that's useful. And we want the researchers to understand through a conversation bidirectionally what people in the broader misosphere have to say about their research. So this really is envisioned as a type of two-way conversational street. And we really want this ideally to inspire a sense of broader and more accepting and understanding community worldwide. Now, the worldwide point's important to us. This is a worldwide phenomenon. This is not something that only happens where you live or where I live. It's really where everyone lives. We now see research studies across the globe looking at misophonia, and more are coming, as you saw on the graph in the previous slide, more and more coming as we speak. So, bottom line goal for today, we want to provide those who have misophonia or experience it as a loved one, or who are looking out for patients or clients, or who are researchers studying misophonia, whoever you are, we want you to feel like you understand some of the more interesting new research. And by the way, there's a lot of research that we aren't talking about today. And we certainly don't have all the time to cover all of the research that's been published in the last year. So we're going to have presentations today that we hope will be exciting and interesting, but also we hope will stimulate you, motivate you to look further into all the other tremendous research being done by people worldwide. Just a quick note here on this slide about resources. We know that people suffer and the resources are very hard to identify at times. And sometimes they're hard to know, what's real, what's true, what can I trust? So we're offering here just a list of websites that we think can be helpful for lay people, for sufferers and family members in particular, but also for clinicians and for scientists and others. And then on the right side of the screen, for those of you who are Instagram people, we're just listing here some of the Instagram pages that provide pretty regular misophonia content that we think could be helpful for you. So I'm going to turn it over to Cris here in just a second, but just a quick visual for you all. This is our day. We're going to go till 5:30 Eastern time with a 1:30 to 2:30 Eastern time lunch break. People will be coming and going throughout the day, but we will have our set times for our presenters, whose names are all listed here. And we hope that you feel comfortable sticking with us for as much as you want. But of course, if you need to leave and come on back. So with that, I'm going to stop right there, and I will now hand the floor over to Cris.
A big question we've gotten is this being recorded? The answer is yes. All of the sessions today are being recorded. They will be posted on YouTube for free viewing, probably the Duke site. I know the soQuiet site will have them as well in a week or so, depending on how much editing is necessary. So yes, this is all being recorded. You can watch this at your leisure sometime in the future for free. And also, as Zach said, thank you to all of our supporters. Thank you to all of you for being here. We've had over 930 people register for this event, so this is the largest Misophonia event in history, as far as we know. So that's very exciting too. All right, that's a quick rundown of Canopy. Feel free to ask questions in the Q&A of our speakers, and I'll be backstage. I'm the stage manager today, so I'll be making everything run smoothly. So if things don't run smoothly, feel free to blame me. But I'll go ahead and hand it over to Dr. Rosenthal and Dr. Brout. Take it from here.
Okay, well, Zach has pulled up my slides. Hi, everybody. Thank you so much for being here today. I'm Dr. Jennifer Brout, and for those of you who don't know me, I have misophonia, and I've been working in the field. I also have a daughter with misophonia who's grown up now, and I'm very proud to be here with both Dr. Rosenthal and Cris Edwards, and we put together just a very short slide deck just to address the basic question, what is misophonia? Okay, Zach, you could advance. So in 2021, I think it was published in 2022, there is a consensus definition of misophonia. And it's important that we think of this definition as a living document, and it will change over time. And in fact, I would venture to say that it has already changed a little bit as research updates and evolves. But I'm going to start with that just so that we're all on the same page. Misophonia includes a low tolerance for pattern-based and repetitive sounds regardless of loudness. Triggers have specific meaning to people and are most often sounds or related stimuli that emanate from other human beings. Once an individual with misophonia notices a trigger, they are unable to distract themselves from that trigger. Misophonia appears to vary from mild to severe and may impact social, academic, and occupational functioning. And finally, misophonia typically begins in childhood and adolescence. Could you advance, Zach? Zach, Could you, thank you. Okay, so just a little more of an updated characterization of misophonia. Misophonia is best characterized as a disorder that crosses disciplines. It does not easily fall into a specific existing classification. And that's one of the things that makes it so complex, difficult to research, difficult to explain to others, certainly difficult to live with. It's not yet in any diagnostic manual, such as the Diagnostic and Statistical Manual of Mental Disorders, which you may know as the DSM, or the International Classification of Diseases, the ICD. However, in the past 7 years, there has been a significant increase, which I know Dr. Rosenthal showed you, in published research studies. But we have to remember that research is still in the early stages when you compare the time that we've spent researching misophonia to other disorders. So we're still in the early stages, but we've made a lot of progress. And again, as research evolves, the way we characterize misophonia will change. Next slide. Thank you. A little bit more. It's a newly studied condition. Doesn't mean it hasn't been around for a really long time. We don't really know yet, but it is characterized by an intolerance of certain common aversive sounds and associated visual cues. Again, it is not related to auditory loudness. It's different from hyperacusis, which is when sound is perceived by an individual as more loud than is subjectively measured. It's not the same as phonophobia, which would be a fear of sound, although both of those can certainly co-occur with misophonia. And in addition, there is an intolerance for many people of repetitive visual stimuli, such as leg shaking, and that was originally reported by Schroeder, and this is sometimes referred to as misokinesia, and you may also hear visual triggers as generally referred to as misokinesia as well. Again, typically repetitive oral or nasal, I'm not going to name the triggers, you can see them right there, stimuli made by other people have been noted in the literature, but recent research has told us that triggers can include non-oral sounds such as keyboard tapping, dripping water, and other environmental sounds. Next slide. I always like to give a simple definition of misophonia that we know is true, but that doesn't mean it's the definition of misophonia. But it's a simple one that I find people can relate to if you're explaining it to someone else. And that would be the brains of people with misophonia misinterpret sounds and visual stimuli as toxic or harmful, and as a result, the freeze, fight, flight response is set off. And this is accompanied by negative or overwhelming emotions and cognitions. Next slide. Okay, now I'm going to discuss a little bit about how people with misophonia describe their experiences. And these are very generic descriptions. The reason they're in here is for those who do not have misophonia, I just wanted to give a little more sort of personal and up-close information. Next slide. So these are some ways that people with misophonia describe their experiences. Sounds are attacking me. Visuals are attacking me. When I say sounds here, assume I'm saying sounds and visuals. Sounds make me feel rage. Sounds are completely overwhelming. Sounds make me want to cry or shut down. When I hear certain sounds, I have to get away. When I see certain visuals, I want to run away. Next slide. And these are just some quotes from people with misophonia. When I hear certain sounds or see certain types of movements, I become very anxious and angry and cannot concentrate on anything else until the sound stops or I can leave the situation. I would do anything to get the sound to stop. I lead an increasingly isolated life because of misophonia. It's a curse that I wouldn't wish on anyone. Next slide. A little bit now about prevalence. So researchers at Oxford University studied a large general population sample. They used a multidimensional psychometric tool, the Selective Sound Sensitivity Syndrome Scale, the S5, which assesses the intensity of triggering sounds as well as the emotions and other reactions related to these sounds. And this was a semi-structured interview delivered by clinicians who specialize in misophonia. And the estimated prevalence of misophonia causing significant stress, impairing life functioning, was 18%. Now, this was done in the UK, and it hasn't been done, as far as I know, in the United States. I think there was also a prevalence study in Germany with some slightly different results, but the take home here is that misophonia prevalence could be as high as 1 in 5 people, which may surprise you. It definitely surprised me. Thanks. Next slide. Age of onset. So in the beginning, in the consensus definition, I did read that the age of onset is usually in the early teen years, late childhood. And that is true, that is mostly what is reported. And so we're going to see that in popular press and in academic research. But we don't have to take that as fact because we don't yet have enough developmental studies. And it's important to know that research has not yet examined misophonia in very young children, but studies are on the way. Next slide. And finally, I just want to end with this message of hope. Misophonia can be very difficult to live with. It's often misunderstood. But with increased awareness, research, and community support, and we're getting great research and we're getting great community support from organizations like soQuiet and all of the people who helped us put this together, we can live increasingly rewarding and serene lives with it, and together we are strong. Okay.
Thank you. We have a couple of minutes till the next session. I do want to mention one thing real quick. This is all of the presentations and presenters. We're going to do our best to make this a misophonia-friendly environment. We've asked that all of the presenters and the speakers try not to make triggering sounds as much as possible. During a live event like this, that is almost impossible, but we are going to be doing our best to speak in a way that's clear and to not do triggering things. So I just want to let everybody know that we're aware of it and we'll do our best. So I don't know if you have anything that you two want to say before we head to the next session in about 8 minutes.
Well, if you know me, you know I it's hard for me not to say things about misophonia. I spend a lot of time every week, almost every day, talking to people about misophonia, whether they're clinicians or researchers or loved ones or sufferers, whoever. So I have lots and lots I could say. I'm not going to say it all right now, though. I'm going to actively inhibit my urge to say a lot. One thing I will say, though, just to add on since we have a minute, is that there is a prevalence study that I'm not going to totally scoop, but I'm just going to maybe more excite you all that there is a new prevalence study that will be coming out soon, done by Dr. Laura Dixon and her colleagues at the University of Mississippi. And this was funded by the Misophonia Research Fund. And this study is going to show in a United States sample. So it's a large sample across the US in a sample that was done in a very, very rigorous way. So lots and lots of people, thousands of people, and sampled in a way that reflects the demographics of the United States, which is hard to do and quite expensive to do when you do research. So this study will be coming out soon. Stay tuned. It is going to show a lower rate than the 18% rate that was just presented, but it will be, to my mind, the most kind of rigorously done prevalence study to date. Certainly the only one that's been really rigorously done in the US. So keep an eye out for that, and I'm hopefully whetting your appetite a little bit about that.
Awesome. If we don't have any final thoughts, we can all kind of start heading over to the next session that starts in about 6 minutes with Dr. Ward. I am very excited about that one. Dr. Ward presented at a Duke seminar last week, and this is really cool. At least to me, I think it's really cool. So I'm looking forward to that one. So if we don't have anything else to say, maybe we can head over that way. Cool. See you all there.